It's a moment of joy amid the rigours of a pandemic. A patient is given a send-off to remember as she's discharged from hospital. It's the latest chapter in an ever-unfolding story at Newcastle's Royal Victoria Infirmary. One that began almost 5 months ago. This is Ward 19, and it's been at the forefront of tackling the coronavirus outbreak from the very start. It was here that the first 2 patients to be diagnosed with COVID-19 were brought on the 31st of January. This is a specialist unit where staff are trained to deal with highly infectious conditions. But as a new virus, COVID-19 brought many unknowns.
It was daunting, a bit frightening, but we are a high consequence infectious disease unit, so that aspect of it didn't really faze the staff. We'd all been well trained.
The whole team was ready. It was excitement in a way, because finally we're seeing patients that we've trained for. But I always had the back of my mind that I wanted to make sure the patients are safe, and especially our staff are safe.
In the weeks that followed, cases of COVID-19 spiralled across the country. More wards at the RVI were enlisted to care for coronavirus patients. 600 staff were trained to boost numbers on the front line. Even for those used to dealing with infectious diseases, these were unsettling times.
The patient is always the centre of our work, and it has been a lot different since this has happened, in terms of patients cannot have their families to visit, have relatives to visit. It's quite upsetting sometimes and stressful, because you do want to help them as much as you can, but you have to be aware that they are at high risk, and we are as well.
Nursing sister Jenny Kane is one of many staff who made personal sacrifices so she could come to work. She isolated at home from her husband, who's at high risk from the virus following an organ transplant.
We actually lived separately for the first 2 to 3 months. He lived upstairs, I lived downstairs. He kind of self-isolated with our 2 small children as well. So obviously that had an effect on me. Yes, I was coming to work on the front line with COVID, but then going home and being terrified what I could pass on to him.
It was quite astonishing how some members of staff were suffering, and they had made enormous sacrifices. They moved into hotels, they sent their children to other family members because of concerns.
At the start of the outbreak, staff here were gleaning what they could from counterparts in China and Italy who'd experienced the virus earlier. Gradually, the Newcastle team began to learn from its own experiences. This ward received some of the sickest patients who were too ill or frail to benefit from intensive care. Instead, they were given breathing support using CPAP, a machine like this. It turned out to have remarkable levels of success.
We had one advantage over the ITU environment. Our patients were wide awake, and therefore they could sit upright. And in the upright position, the lungs work most efficiently. And we think that might have been the reason we saw such good results with CPAP.
What do you understand now about COVID-19 that you wish you'd known at the start?
Very early on we tried to pigeonhole it into being, it's a bit like this disease, it's a bit like that disease. We tried to label it, and it took us a while, I think, to realise it's its own disease. It's not that much like anything we've seen before.
From a peak in April, the number of people being treated here for COVID-19 has dropped significantly. But with patients still critically ill and sadly dying, everyone is on their guard for what may come next.